Great, thank you. Okay, good afternoon, everyone. Hope everyone's doing well today. Let's go ahead and do roll call. Valerie Richards. Valerie, do I see you? Yep, I see
Yeah.
you. Are you there,
Yeah.
Valerie?
Well, I'll actually put my video on. Hey.
There you go. Hi, Valerie. Linda Winstanley, you are here.
Here.
Julia, you are here. Grant, you're here. Linda Whitney.
Here.
Yep, there you are. Miranda.
I'm here.
Okay. Kirsten.
I'm here.
Yep. Amber. Do not see Amber yet. Okay. Seamus.
I'm here.
Okay. Jill, I just saw you pop in. Hi, Jill. Lisa's here. Monica. Yep, there's Monica. Okay. Shira, you are here. And
Present.
today we have a guest who is sitting in on our meeting, observing. Her name is Carrie Seals. Is Carrie here? I don't see her. She was supposed to be here, but she may still pop in. Um, anyway, Carrie is a new employee of CBH, and her and I were working on some things last week. And I told her about our group, and she was interested in observing. And so I invited her, and she got the email notice to of our meetings. So we'll see if she pops in. Anyway, let's go to the agenda, February 6th agenda. Has everybody had a chance to look at this agenda?
Yes.
Okay, does anybody have any changes to the agenda that they want to look at? If not, then I need a motion to approve the agenda as is.
I'll move that we approve the agenda as presented.
And a second?
I'll second
it.
Okay. And then let's go to, okay, so the motion has passed to approve the agenda as is. Minutes from the January 2nd meeting, everybody had a chance to look those over. And if so, any changes, any discussion on those at all? If not, then I would like to get a motion to approve the January 2nd minutes as is.
I'll move that.
Second?
I will.
Okay. Motion has passed. Let's go to public comment. I don't believe we have anybody from the public today. So we'll move on to discussion, and we're going to pick back up with Lisa from our last meeting. She had a lot of things to talk about, and we ran out of time. So Lisa, it's all yours.
Thank you. Let me switch gears and I'll pull up I just have a couple of things that I was going to show you guys. Okay, so my thing is in the way, so I can't. There we go. Okay, there we go. Can you guys see that?
Yes.
Yes.
So the first thing I was going to talk about is the health equity plan. So this is part of our public health modernization that we write a health equity plan. And so we did an assessment finished in 2021, and now we are, post-COVID, finally into writing the plan portion of it. So I wanted to talk a little bit about what equity is and thinking about it from a health perspective. So I liked this picture from Johns Hopkins because it really shows that the game would be the services that our community offers that you want folks to access. And when you're looking at equality, if there's a fence preventing you from accessing, or in this case, viewing the game or accessing those services, then depending on your height, depending on your abilities, you may or may not be able to see over that fence to see the services. With equity, you're looking at what is it that people need to be able to access those services. And so the goal is to try and help the maximum amount of people in our community access the services that we provide, or the resources that are available in our community. And so sometimes that means that you have to administer those services or make them accessible in different ways depending on what people's needs are. So for our health equity assessment, the process that we're going to go through is, and we're working with a contractor. We've contracted with Reed Group, who we've worked with in the past and who helped us write our health equity plan or our health equity assessment as well. So we're going to be contracting with them to create a project plan, to write and synthesize what we're already doing, and get feedback on the assessment that we did, and from the community, and then develop a plan, get feedback from the community as well on the draft after we create it, and then design materials to disseminate the plan to the community and implement the plan. So we kind of move from looking at what we already have and getting additional feedback to developing a plan and then sharing that draft, and then making sure that after we finalized a plan that we are actually working on the metrics that we've set forth, and that we're sharing that plan with the community. The slide didn't, you guys aren't looking at scope of work right now. It's still just showing the health equity picture. Oh, okay. It's not, I don't think it's sharing the right screen. Okay. There. Now can you see it? Okay.
Yes. Yes.
It's like it's projecting it on the wrong screen. So so that's kind of the process that we're going through for this. So what I would really love from you guys is to incorporate you into the process as well, because folks who have disabilities or are experiencing substance use disorder or addiction, those are all part of kind of the spectrum of what we need to be thinking about when we're designing a plan, of looking at what people need in the community in order to access the resources and services that are available. The scope for us is our own services. Emergency management has also decided that they would like to participate in this process as well. And we're also having Jen Benoit, who is the communications, the public information officer for the county and does communications. She's also going to be a part of the planning committee. And so you don't have to decide now, but maybe at the next meeting, it would be great if we could decide if one of you wanted to be a representative on that council also, or on that planning committee as well. I think that we would just be asking you to come to maybe one of the meetings and then give us feedback on the plan. And so you would want to get the opinion and the of the council and bring that with you to that meeting, so that you would be representing the Human Services Advisory Council in that group. So if you're interested in that, you guys can get back to me next meeting on if you would like a representative. Any questions about health equity? I'm going to try to.
Yeah. Hey, Lisa, can you put that on the next agenda?
Yes, I will put that on the next agenda for sure.
Perfect. Thank you.
Do you guys have any questions about health equity in general, or equity? Is that a term that you guys are all familiar with?
Mm-hmm.
Yeah. Okay, great. Then in that case, I'll move on to my next agenda item, which is the harm reduction program. I can share my screen again. So, so we did a assessment of our harm reduction program because there's there's just some things that have changed in that program, and we want to make sure that we're providing the services to the community in the most efficient and effective way possible. So some of the things that we've dealt with internally have been that there's been a lot of staff turnover in the health department. We have had kind of a lack of available data that's really easily accessible to us, even though we've been gathering data this entire time from the program participants as they come and access our services. The way that it's compiled is not very efficient. So we've actually been working with our IT department to create a data tool, and that's going really well. And we're hoping that that really increases the data capacity of that specific program. And then the harm reduction program also just has a lot of logistics to it. It requires a lot of storage space because we're constantly getting more supplies that then we're giving out in the program. So are you guys familiar with the harm reduction program? Maybe I should have started with like an overview of what it is that we do right now. Would that be helpful?
That would be helpful. Yes, Lisa.
Okay.
Please.
So our harm reduction program, we currently offer a syringe exchange. So if people bring used needles to us, we give them clean needles, which helps with communicable disease transmission. It reduces that. It reduces people getting infection from using used needles. It also, we give them sharps containers. And so it encourages people to, and gives them an avenue to dispose of used needles in a healthier, safer way so that they aren't ending up in trash cans. And then potentially there's needle sticks for the people who are, sanitation workers or the people who are emptying the trash or in other places that that they're not supposed to be disposed of. It's also an opportunity for us to connect with folks who maybe could use more resources or referrals. CBH has their prime peer come with us, Adriana, who's really great. And she's at pretty much every event, and she does a great job connecting folks with resources. And then we try to stay up to date, and we have a resource list that we keep too to make sure that we can refer people to whatever it is they need. And then we also give out fentanyl test strips when we have them, and we show people how to use them. And we give out safe injection kits. And also safe sex supplies. And then if we have hygiene products or snacks or anything else that we can give out that people would like, then we give them out at the program as well. So it's really a way for us to connect with folks and do some education around using drugs in a safer way and connect them with other resources so that if they're ready to reduce or go into treatment for their drug use, then they have that resource available to them, and they know that we're there once a week and ready to connect them with whatever they need. Do you have any questions about the program? Anyone? Okay. So then for the weaknesses, staff turnover, there's a lot of data that we try to collect on what and how much of things we've been giving out and who has been accessing the resources and in what way. We also have a large storage space need because there is a lot of kind of materials that go with that program with the sharps containers that we're constantly getting and then packing up in our van and giving out. For the kind of external threats that we're looking at right now, we go out one day a week and we go to Seaside for an hour and a half. We go to Astoria for an hour and a half. We used to go to Warrenton, but we don't anymore because we didn't have a location where we could we like to have like an MOU with the location that we're parking. And so we didn't have a location that seemed like it was going to work for that or that we could find someone who wanted to sign an MOU with us. And then for Astoria, our Astoria location is kind of behind Safeway near the Riverwalk, and they've just built some new apartment buildings right there. And so it's not quite as like private and anonymous as it used to be, and we foresee that location not working for us long term, or potentially working for the apartment complex long term. So we would like to start exploring other places that we could park in Astoria too. Um, and then we also are probably going to have reduced funding. The burn grant hasn't been decided, but we asked for $600 and something thousand, and we're probably going to be awarded around 100,000. And that's only one stream of funding for this program, but it was a significant amount of money over the 3 years. Valerie, you had a question?
I just wanted to say I have an idea for a location in Warrington.
Oh, okay.
I don't know if it'll work, but if you want to call me after the meeting, I'll put my work phone number in the
Oh,
chat.
perfect. Yeah.
I just had an idea because I live in a condo that I'm a board chair, so I was going to propose maybe there's a space in there that might work, and I'll talk to
Okay.
the board members and see what we can do. But we'll have a conversation about it.
Okay. Yeah,
You'd like.
that sounds good. Yeah, the locations that seem to work are ones that are kind of tucked out of the way so that people don't feel like there's a lot of other people watching them when they're arriving, and where we're not like bothering anyone else, So yeah, but we just bring our van once a week for an hour and a half. So that's great.
I
Thank
think
you.
that could possibly work. I'll just have to bring it up with the other board members, but
Okay.
we'll talk
Well,
to you about
great.
when that'll happen.
Thank you for helping us problem solve. And then as far as locations, we're not going to other locations. Tillamook and Columbia both have harm reduction programs, so we don't make it as far out as Napa or Jewel or Arch Cape with our harm reduction program. But we have people who come sometimes all the way from Tillamook or come from Pacific County to access our program. It just kind of depends on, I think, what days a week work for them and where the harm reduction programs and other places are. So then we also, statistically, there's less people who are using injection drugs. People who are using drugs, they are using less injection drugs, and they're doing more smoking or snorting. And so I think because one of the main draws in our program is the syringe exchange part, if less people are using syringes, which is not necessarily a bad thing because syringes are very high risk for communicable disease transmission and infection. But if that's the main supplies that we're giving out, I think I also forgot to mention a really important part that we give out Narcan. And so, but the syringes are really what draw people in a lot of the time. And then we can offer them things like the resources and the Narcan in addition to that. But if there isn't the draw for syringes because they're not using syringes, then that means that we just kind of have less of a relevance for those people with our program. And same thing with reducing program engagement. We've had just steady reduction in program engagement, and that might be because less people are using syringe drugs. It could be for a variety of reasons. Maybe it's, our advertising isn't as strong, and so people don't know that the program exists. And then also there's still, as I'm sure you all know, a lot of stigma and misconceptions and controversy around the idea of doing harm reduction. And so that kind of stigma is something that we're also constantly kind of battling against for this program. So makes it a little bit more controversial. So for the strengths, we're also a part of the BURN partnership, the Behavioral Health Resource Network. That's with CBH and, Amber, you have a question?
Yeah, I just wondered real quick, you talked about the advertisement that you guys have for the program, and I'm curious, what does that look like? How do you guys get the word out?
We have it on our website. We post on Facebook and Instagram the day before each event, and we try to we have it in our brochure, and we try to make sure that all of our community partners that we work with know about the program. I think that for the last couple of years, we've had kind of reduced reduced advertising for the program. And so, I don't know if that's negatively affected the program or led to the lower numbers. We already had reducing numbers before we reduced our advertising. But that's just another option for maybe opportunities to do better.
I am curious about having like if do you have flyers up in different locations?
We don't have
Because that's
flyers
kind of
up.
what I was thinking.
Yeah, no, that's a great idea to put flyers up. We don't have flyers up. We have little flyers that we give out at outreach events. And we
Okay.
just recently switched them to being business cards because I felt like business cards were a little bit more discreet. And it also has a QR code for the Narcan training so that they can scan. So if we're giving them Narcan, we give them this little card every time that has the harm reduction information on it and has a place that they can watch the Narcan video. And usually we have people watch the Narcan video right there before we give them Narcan. So
Okay.
yeah. But like our harm
Awesome.
reduction staff, they went to the new drug talk event that was in
Mm,
Seaside.
right.
And they gave out 150 doses of Narcan. Um,
Awesome.
and each
Yeah.
one of them had a harm reduction card as well, so that they could access the weekly event. But that is a big part of the program too, is the giving out Narcan at community events, and we do trainings for different organizations. We've done them for grocery stores and for um, Parks and Recs and just all different kind of organizations and businesses. So
Where can I get some of those business cards for my office?
we have them here at our office and we'd be happy to share them. We just made them less than a month ago. So I don't know if we've started giving them out a ton, but I'd be happy to
Okay.
give you a stack. So
Yeah. Awesome. I'll
thank
have
you
to
for
pop
asking.
by. Thank you. Yeah.
Thanks. Um, so we're also part of the Save Lives Oregon leadership team. Save Lives Oregon runs the clearinghouse that gives out Narcan and syringes, and you get they just have a big fund, and they buy a lot of different materials for harm reduction services, and then they distribute them throughout the state. They also were distributing Narcan to schools, and we're on their leadership team. We're just kind of re-engaging after staff turnover with that team. And then we have a really consistent schedule for our harm reduction events. We did have to cancel this morning from ICE, but they went out this afternoon and picked back up and were able to do the Astoria location. So it's basically only holidays or inclement weather that stop us. We go out every Thursday other than that. Some of the opportunities is closed loop referrals. Right now, we're referring people to places. I think CBH is a really great partner for closed loop referrals, where they're doing a little bit more of that. But our staff, when we're giving the referrals, we could be following up even better on that and making sure that people connected. And then we also just want to affirm that our partnerships with, like our peer partnership with CBH is a really huge advantage to the program. And if there's an opportunity for us to affirm that, then or partner more, then that would be an opportunity to us. And then communication with advocates, partners, and the public. We think that we could be doing a better job of that and expanding it. And then offering harm reduction supplies beyond injection drugs and safe sex. Maybe that would help negate a little bit of the relevance issue with injection drugs. And then partnering with schools for harm reduction to reach youth and families like we did with the new drug talk, but there's probably more opportunities there. And then raising more awareness around substance use disorder and offering professional development to our staff so that they're able to talk about it competently with the public and help reduce stigma and misinformation. So the second page, which I wasn't going to go over because it's its whole own thing, but I know I included so that if you guys wanted to dive deeper, is the harm reduction framework. And this is from the Substance Abuse and Mental Health Service Administration, SAMHSA. And they have a whole toolkit on kind of what harm reduction can encompass. Obviously, that's a very high level overview. And so all of the examples and all of the strategies in there aren't something that our harm reduction as a syringe exchange program and doing Narcan is going to be able to do on our own. But CBH and Providence Bob Team, and there's lots of other activities that are happening in the community that other organizations, including CCA, are doing that are included harm reduction. We're the only one who's providing the syringe exchange portion of it, but lots of other things that are in the framework are included. So I just wanted to share that with you guys, and thank you, Valerie, for having the feedback, and Amber, if any of you guys have any feedback for me or any other questions, I'd be open to those, or you can email me.
Lisa, could you maybe just email us a copy of that business card? And that way we would have the QR code too.
Yeah, I can email you a copy. Yeah, the ones that we got printed are they're like the plastic ones, so they're really nice because if they get wet or if you put them in the washing machine, they should still be good. But you can totally share the digital copy of it too, and that would be really great. So yeah, I'd be happy to include that in the notes afterwards.
Great. Thanks, Lisa. Any more questions for Lisa?
I just
Lisa,
wanted to
have
say
you-
thank you. Oh, sorry. Thank
That's
you,
okay.
Lisa. This is really good information. So I appreciate that you shared and took the time for that.
Thanks.
Yeah.
Have you heard about the dried blood spot research program the professor from OHSU is rolling out?
I haven't.
So it's like a finger prick and in the field Hep C and syphilis testing that like they want our prime peer to do, which we're like weighing right now whether or not we have capacity for that. I don't know why they're only connecting this to like prime peers, but it feels like a really great thing for like public health harm reduction to also take on, even if we're doing it too. So
Yeah.
if you're interested in that, Lisa, then I'll reach out to the professor and see and also the state because they're like partnered in that work.
Yeah, I think that would be good. I should check with Nadine, who's the harm reduction coordinator, because we do Hep C screening, which is a finger poke. We don't do it at our harm reduction because we don't quite have our process set up well enough to be able to do that. But I know that we do it at some community events, like we did it at Homeless Connect. We did Hep C screening where we did the finger poke for it. And then if somebody comes back positive on that, that's just a screening. So they need to do the additional follow-up. And I know that Nadine is going to the PATHS program meetings once a month. So let me, if you want to forward me the information, that'd be great. And then I'll ask Nadine, like, is this what we're doing or should we be doing this?
Sounds good.
Thank you for
Perfect.
thinking of that.
Yeah.
Okay, any more questions? Lisa, do you have any more for us?
My data capacity assessment update is just that we have decided we're doing a youth prevention needs assessment also. And so we've decided to use the same contractor for the youth prevention needs assessment as for our data capacity assessment. So the plan now is to do the youth prevention needs assessment, which is looking at what kind of prevention programming or needs schools and youth need in our county. And then we have our community health needs assessment that's coming up pretty soon. And between the two of those, after those, we're going to look at what we can take from those experiences and use that to kind of start the data capacity assessment. So we have chosen a contractor. We're not going to sign with them until we're through with the other things that we've planned to do with them. And then for the data capacity needs assessment, and then we'll start those sometime in the new fiscal year. So after June, sometime after July of 2025, we'll start working on that. So that's my update for the data capacity assessment that I know you guys said you wanted me to give you updates on.
Okay, Great. Thanks, Lisa. Any more questions, comments for Lisa? Okay. Thank you, Lisa. Let's move on to Shira. You're up. What
I
do
don't
you?
have a fancy PowerPoint. So, um, just a couple of things that I think would be helpful for you all to be aware of. Two primary areas of focus for CBH right now are youth services and specifically youth substance use disorder services, and really honing in and focusing on our partnerships with schools. I'm sure many of you heard about the new drug talk that happened, and we're wanting to see more of that and partner with other schools that haven't kind of brought us in that capacity yet. And then working with different funders to try to find some additional funding to actually get substance use disorder counselor capacity to rotate through the different school districts throughout the county. Because we've heard a lot from young people that some don't necessarily want to access that on site at school, but some do. And for us, I think we would make it a psychoeducation slash treatment kind of position so that if kids came to utilize the service, they could just be coming to learn about substance use. Maybe someone in their family experiences it. Maybe they're just wanting to like educate themselves, or maybe they're coming for treatment, but you don't know. And that's sort of a way to kind of keep the that resource a bit confidential for young people. So no funding yet, but something that we're working on. The other area of focus is interpretation and translation, and making sure that our Spanish speaking population in Clatsop County has access to behavioral health services. So we've done a lot of internal polishing and made sure that our documents are all translated, that our website is easily accessible in Spanish, and then also working with CPCCO to secure funding for a full-time in-person Spanish navigator slash translator, so we can actually have a real life person do that work with clients. Historically, the resource that had been offered to us for that work was a third party virtual service. So if you have a Spanish speaking person and an English speaking provider, you would call this third party and have someone pop in on the phone or pop in virtually and try to like translate that session. It's not super meaningful. It sort of feels disconnected for people in the moment, just not the greatest resource to build relationships and those types of connections. So I've been really advocating for funding for an in-person Spanish speaking bicultural bilingual provider. I think it'll also provide some opportunities for us to network with the Spanish speaking population in Clatsop County as an organization. So that work is moving and looks promising. And then just the other thing that I kind of wanted to highlight for you all, when I started with this organization, going on, it'll be 9 years this fall, there were 65-ish employees at CBH, and we have 150 now. So we've grown significantly. And sometimes our programs grow faster than our infrastructure. And so what we're doing now is really focusing a lot of attention on making sure that we're doing everything at an A+ level, that we're not just doing a lot of things kind of okay, but that every service that we offer is excellent. We have a deputy director, a chief business operations officer, a quality director. So we're actually able to track things, look at metrics, leverage data, and just sort of overall be a more sophisticated organization that will really contribute to, I think, the improvement of overall clinical care in the community. So that's my update for you. Questions?
Questions, comments? No?
I have a quick question.
Okay.
So Shira, I'm wondering about that, the youth SUDS counseling and like psychoeducation in the schools. First of all, love it. Think it's awesome. I think it's overdue. I'm wondering two things. One is, have you thought about trying to implement some sort of peer support program with that? And then the other question is, do you have a goal in mind? I understand you got to find the funding and stuff like that, but do you have like a timeline that if everything worked out the way you want it to, that you have in
Totally.
mind?
So, yes to peers, and the 7 peers that we have are already really excited about working with the school. So, I don't necessarily need to hire somebody else. I just need to I just need to operationalize those relationships and figure out from every different school in the community, like, when are you okay with my staff kind of being there to hang out? Like, they want to just come during lunch and bring pizza and like get to know young people and sort of make talking about substance use more normal and more accessible. So those are things that can happen without any additional funding because I already have the staff who are excited about doing the work. I would love to have secured funding for, I just want one position to start with who I will rotate through the different school districts in the county. Um, and build from there. My goal is this year, of course, like with the federal chaos, is what I'll call it. Like, no one knows what's really happening with funding or if things are going to be more limited. And so we'll see how that goes. But yeah, I know it's a huge need. So it's definitely a priority.
Thank you. I love hearing that.
I don't have a question, but I have a comment. I just want to compliment Shira and her team on the groundbreaking recently for the permanent supportive housing. It was great that you were able to have good weather for it. And it was just awesome to hear so many positive comments about the need for it in our community and what a difference it's going to make. So good job.
Thanks, Monica.
Nice.
Yeah, it was great.
Okay. Thanks, Shira. Any more comments or questions? All right. Thanks again, Shira. Let's move on to public health and Jill. Hi, Jill.
Hi. Sorry, I've been multitasking here and I have a staff in my office. So I don't have a report right now.
Okay. All right. We'll move on. Thanks, Jill.
Yep.
And we'll go back to Lisa. You have any more for us?
So our WIC program has been working really hard and been super busy, and they broke 700 participants in the county in the last month or two, which was something that the state office congratulated us on. And that was for the first time in a really long time that we've had that amount of participants. We're hoping that the current political atmosphere doesn't reduce that number. It did during the last time that we had this administration. They went down significantly. So we're hoping to do messaging and to kind of keep those numbers up. Because our funding is based on the numbers. And when you look at the number of people who are eligible in the county and the number of people who are using it, we like to see that the more people who are eligible are using it and aware of that service. So I think that's my main update. I already mentioned that we're starting the youth prevention needs assessment. We're signing a contract with our contractor right now to start working on that. It'll be completed by July or August of this year. So it'll be pretty quick. And I think those are my main updates. We're doing I forget what TARA stands for, Jill.
Tobacco alcohol retail assessment.
Tobacco alcohol retail assessment. It's something that the state is doing across the whole state, and they're partnering with their local tobacco prevention and education programs to implement that. And so we're going to be going out and using the help of the young person who helped us do our young adult tobacco inspections, also to check that tobacco retailers weren't selling to youth. They're going to come back on and help us go out and look at advertising around alcohol and tobacco in convenience stores and other locations that sell it. And then we'll report that back to the state so they can kind of do an assessment of how things are being marketed, especially to youth. They're looking at what levels they're at and what styles they have of that kind of marketing. So I think those results will be really interesting, and we won't have them back for a while because I think this goes through June also, but when we have the results, I'll share them with you guys.
Great. Thank you. Grant, do you have a question? Oh, no. Okay.
I have a question, Randy.
Go ahead.
I'm just curious. You said over 700 people are involved in WIC. I'm assuming that's families. And I'm just curious, does somebody have a number of how many could qualify in the county? 700 seems great, but low. I'm just curious.
Yeah, and that's individuals, so that's not families.
Oh, okay.
Some of those could be part of one family. So 700 is the number of participants, but I can share the WIC data, the last data sheet that we have. I think it's from 2023. I don't think that they've come out with the 2024 one, but it shows you how many people could qualify. I'm pretty sure that one shows how many people qualify and then how many people used WIC. Jill's looking for it. She probably has a printout of it somewhere.
She's got everything.
Yeah, Jill can tell you.
I don't know that this doesn't say how many people would qualify that aren't on WIC. Let's see. But what I can say, I know that we can get that though, because we did get information of like the percentage of OHP that were not on it. Like I know that at one point we had that. We got that from I don't know if it was from CPCCO, but we were able to get it.
I'm just curious if you have the number, that would be interesting.
It was we are at that point our numbers were low. Like we were creating partnerships and looking for pathways there, because when we were doing this, it was probably about a year or so ago, and so we were looking at like how can we get more of our OHP folks connected to WIC. So
are most, I really don't know, are most of the kids who qualify for OHP in the county on OHP?
I don't know what the percentage is for how many people who qualify for OHP take advantage of it, but I know that if you qualify for OHP, then you qualify for WIC.
Yeah. Okay.
So looking at the number of people who have OHP and then looking at the number of people who aren't using WIC, even though that's another service they'd qualify for, is usually a pretty accurate number.
Thank you.
Okay. All right. Thank you, Lisa. Any questions, comments for Lisa? Any more? All right. Thanks again, Lisa. Let's move on to Monica. You're up.
Hello. So you all on the agenda from me had requested a grant funding update, and unfortunately, we will not be allocating the funding to outside agencies this year. Our board is really looking at ways to reduce our expenditures, which includes like Lisa's mentioned in her report. You know, there's been a lot of staff vacancies, and we're going to continue to hold those vacancies, especially in the general fund department, vacant, as well as some other cost savings measures. And so unfortunately, until we have a better idea of what our future revenues will look like through timber replacement, as well as some legislative work we're doing around transient lodging tax, we are on a status quo with reductions budget process. So that is unfortunate, but the county core services is what the board's focus is on maintaining. In
Monica,
regards to the,
Monica, I have a quick question for you. Is that mainly due to the Wanna filing?
That's funny that you went to that one. No, but that's just another component of it. And so a lot of it has to do with our general fund is primarily funded through property taxes, which the Wanna Mill filing does have an impact on that, as well as timber revenues, which the HCP has an impact on that. And at this point in time, we know that there's going to be reductions in timber revenues. But the governor's office hasn't provided us with any information in regards to what revenue replacement for the county is going to look like, since they're reducing our timber harvesting. There's essentially 15 15 counties that are called forest trust land counties, and we had forests that went into foreclosure years ago in the early 1900s. And then we turned those over to the state to manage. And so they, as part of the Habitat Conservation Plan, as far as the highest permanent value of the forests. And so, and finding that environmental balance with the forest and the timber harvesting means about a 35% reduction in timber harvest. And so for Clatsop County, that's going to be on an annual basis between our general fund, our rural law enforcement, and our road district and 4-H and fair. That's going to be about a $6 million annual impact to us. And so we're trying to figure out what that's going to look like for us moving forward to make sure we can sustain our core operations.
Sure. Okay. Thanks.
Yeah. In regards to the commissioner appointments, our commissioners have been having a lot of discussions lately and trying to figure out who is going to be doing what liaison appointments is a conversation that's taking a little bit longer than we anticipated. And so, unfortunately, I don't have at this point in time who your liaison is going to be. Hopefully by the next meeting in March, that will happen because I'm really hoping that in the next couple of weeks, Chair Quila will have had the opportunity to meet with all of our commissioners to kind of have those conversations. But I don't have control over what our board does. And so at this point in time, it's just kind of a wait and see approach. And then I just also wanted to comment on the deflection program, which we work closely with CBH on. I had an opportunity a couple weeks ago to go to a deflection participants graduation. And so they are, if they choose to, because it is a voluntary program, if they choose to go through deflection to have some of their potential citations, erased, I guess.
Criminal charges.
Thank you. Criminal charges erased for that particular, for the possession of a controlled substance only. They have to participate in the deflection program, and it's a 90-day program. And that looks a little bit different because it depends on the individual who's participating. And so for some, it might mean a lot more meetings. For some, it might be a little less frequent. And so it's kind of tailored. Isaiah is the individual who works closely with that program, and he was at the graduation as well. And so it was really nice to hear the feedback from the participant and the compliments that he had for Isaiah. And that is our second graduate from the program. We are currently, I believe we're still at 6 as of our last meeting, which was a couple weeks ago. And so we are continuing to explore ways that we can get more participants involved, because like I mentioned right now, it really is just about that possession of a controlled substance. But then oftentimes when law enforcement engages with them, the individual might be doing some other sort of crime. And in those instances, we can't always engage them in the deflection program because those crimes wouldn't. You can engage them for the controlled substance, but you can't engage them for the other crimes. But we're looking at ways that we might be able to expand the other crimes that could qualify for deflection. Does that make sense, Shira? Yeah. And because we also want to make sure that we're not doing anything to harm the victim of a crime potentially. So, what else was I going to say? I think that's all that I have for now.
Okay. Hey, Monica, I have a question for you. So on the agenda, we have Anthony Pope, the county council, will present at our next meeting. Can you speak to this a little bit, please?
Sure. So, he's our county counsel, and he just provides ethics training. So in regards to just your role on a committee, what good behavior is, what you should and shouldn't be doing as a representative of the Clatsop County through HSAC. And so, and and oftentimes, your role doesn't have as many what one would call conflicts of interest, but we just want to make sure that all of our boards and committees have a good understanding of their roles and responsibilities for representing the county.
Great. Thank you. Any questions or comments for Monica? If not, thanks, Monica. Appreciate it. We'll move on and to the good of the order.
Randy, I
Anybody-
can do just a quick one now that I'm
Sure.
able to focus just in
Okay.
this. It is super, super quick, but I just wanted to also add with Lisa's assessments that she was talking about. It is time for public health 3 years later to do our community health needs assessment. We're partnering with Providence Hospital and Columbia Memorial Hospital on this, and we are actually contracting with the same contractor that's going to be doing our data assessment and our youth prevention assessment. It's really going to add, I think, some efficiencies with it all. So it's you'll be hearing more about that as we start getting rolling, and we will be also bringing stuff to this group as well. I just wanted to let you guys know that that was also happening. And then also, Monica mentioned the legislature. We're closely following the legislature and how it's going to impact public health this year. There are some legislative concepts as well as some bills that are out there that will support a lot of our primary prevention work. Our WIC, there's a bill for WIC, there's a bill, or I'm sorry, a legislative concept right now for WIC, a legislative concept for maternal child health, public health modernization, lots of different things that are affecting environmental health. So there's just a lot that we're watching there. And if you guys are interested in hearing about any of that, then
Sure.
we can have
Absolutely.
share that with you.
Great. Thank you. On another note too, I noticed the Providence looks like they've all come to an agreement. The picket lines at Seaside, Providence are down now. So just something to share. Okay. Any questions for Jill? Comments? Okay, let's move on to the good of the order. Does anybody have anything?
I was just going to give a quick update, Randy, for what you just said. The
Sure.
Providence nurses, fairly certain that they voted near unanimously against the what Providence had offered. So I believe that there's some groups of different medical professionals that did agree, but then won't come back to work. So they won't come back until the nurses have agreed on a contract. So last I heard, as of yesterday or this morning, that they turned away what Providence was offering. So
Really?
as far as I know, it's still going.
Oh, wow. Yeah, I know they voting like today or tomorrow or
It must have been this
Saturday?
morning.
Yeah.
It must, yeah. My twin sister is a nurse at Providence, so she called me kind of fired up this morning, so that's why I have that update.
Well, I drove by early this morning and they weren't out there and I figured it's cold and they'd probably start later, but then I just drove by again on my way here and they're not out there. And I thought, oh, well, they must have come to an agreement. So that's good to know. I know last week I stopped by and it was cold and I stopped by Safeway and I bought a whole bunch of different brands of muffins and stuff. And I brought it over and dropped it off to them. So anyway, well, that's good to know. I'll keep my eye on that. Thanks.
I know my sister made chili for everybody today. So
Oh,
maybe
good.
they ate their chili and then they headed home because they were cold.
Okay. Thanks, Amber. If nobody has anything else, I have a couple of things I would like.
Shira's
I
hand
think
is
Shira
up.
has her hand.
Oh, Shire, I'm sorry.
Thanks, everybody.
Sorry. My screen keeps moving around here.
I'm just in the small amounts of conversation we've had about the national landscape and some conversations that I've had with CPCCO, Columbia Pacific Care Oregon, and other providers in the community. I'm just very aware that that our Latinx population is very much being targeted right now. And that means that a lot of folks are not utilizing healthcare, are not showing up to work, are not going to the grocery store or not doing things that they typically would do to care for themselves, specifically in accessing healthcare services. And I know that people are already tracking those numbers and are already seeing like a decline. And so I just want to say that in sort of every arena that I can say it in that like it's going to take our community to figure out creative ways to make sure that that portion of our community and population is well supported and safe and cared for as people are literally going underground. So would appreciate, that conversation to be brought into other spaces, as it's no one's immediate responsibility, but it's all of our collective responsibility to care for everyone that lives here.
Great. Thanks, Shira. Anybody else? Okay, if not, I have a couple, 2 or 3 things I want to chat about real quick. Starting March 1st, we have our officers, myself and Linda Winstanley will be, we elect new officers every March. So Lisa, if we can get that on the agenda for our next meeting, election of officers, that'd be great. And so something to be thinking about. And then speaking of that meeting on March 6th, so I really would like to be at that meeting because it's an officer meeting. Plus we got the county council there, but that day is my birthday, my 66th birthday, and I'm going to be floating down the Wilson River steelhead fishing. So I will not be available that day. I will not be back by 3. I can guarantee you that. So I'm wondering what y'all think about maybe switching that meeting from March 6th to maybe March 5th or March 7th.
I cannot do March 5th. It's budget time for us, and so my schedule's pretty booked. But
or even March 4th.
I could do March 3rd, or I mean March 7th, which is a Friday.
That's a Friday.
I might be late though, because there's a meeting right before that. But yeah, I could do the 7th.
Okay. Well, what about everybody else, schedule-wise? March 7th?
I will have to check with county council since he was planning to be here on the 6th.
Oh, yeah.
The 7th in the afternoon? What time on the 7th?
Same time, 3:00.
Brandy, that works for me, but I have to tease you because today's my birthday and I'm here, and we have the common, not the 6th of the month as both of our birthdays. So I felt the need to share that.
Well, happy birthday, Valerie.
Thank you.
But
Happy birthday.
I'm still going fishing.
It's okay. I just had to tease you.
That works for me, Randy. That's fine.
Okay. And if it doesn't work,
I'm good with that.
Council, maybe we can present at the next meeting at our April meeting.
You got very gurgly.
Maybe if the county council can't meet at
I think you said maybe if he can't do that meeting, we can do another meeting, and we'll figure it out. I'll work with Lisa and Anthony, and we'll get it.
Okay.
Yeah.
How about everybody else? Does March 7th work for you? Yes?
Yep. Good with me.
Shira, does that work for you? And Jill, does that work for you?
I will make it work.
Amber makes it. Jill, how about you?
It doesn't work for me, but that's okay because it needs to work for all you guys.
Okay.
It doesn't work for Linda either.
Okay. Shira, how about you?
Yes, I think that will be fine.
Okay. And Lisa, does that work for you?
Mm-hmm.
Okay. Kirsten? Okay. And Julia, you said yes. And Valerie, you said yes.
Mm-hmm.
Okay. Amber is a yes as well. And Grant? Yes. Okay. Is that okay with everybody then? Changing it to March 7th? Sweet. Thank you so much. I appreciate that. So it'll be March 7th at 3 p.m. And those who can't make it because of this.
I can't hear you at all now.
Yeah, you're
Yeah.
warbly again, Randy.
Must be my connection. I said if those that can't make it, we'll have them as an excused absence because we changed the meeting. Did you hear that?
And I would just say if anybody that can't make it and they want to be nominated or anything like that should work with Randy.
Correct. Yes. Okay. And then one more thing. Can you hear me okay?
Yes.
Okay.
Just stay close to your mic.
Yes. One more thing. I just wanted to go back and chat about Carrie Seals, who said she wanted to attend this meeting. Carrie is a new hire to CBH IADD, Developmental Disabilities section of CBH. And one of the things that I don't know what all of her roles are, but one role is she has revived the ED Services Advisory Group, which has been on hold for several years now. Many years ago, I was part of this group, and back then we had maybe 4 or 5 people in this group. And then earlier this month, she revived that. So a lot of South African parents, agencies, and we had a meeting, our first meeting, we had 17 or 17 people there. Bylaws, officer. So
We can't hear you again, Randy.
that's going to be on our next agenda item. You hear me? No.
Yeah,
We heard that
can hear you.
something's going to be on the next agenda item, but we don't know what.
Well, we're talking about possibly this group becoming a council and having bylaws, and
We can't hear you again.
okay, I will send out an email. Okay,
Yeah, if you could send out an email, Randy, that would be wonderful.
I will do that. And Amber, I thought about you on advisory council as well.
Sorry, what was that?
I said I thought about you for this advisory council as well.
I know that someone had approached me about it and I thought about it, but I've got a lot going on right now. So I don't
Okay.
know if I can commit to one more thing.
Okay, so can you hear me okay?
For now.
Okay, for now. So anyway, one of the things we're talking about is, like I said, this maybe forming a council, have bylaws and officers. And another thing we're creating, I've been tasked with creating a Facebook page for our advisory group, and I'm working with Carrie on that. And we met last week, and we're going to further advance that. And so once we, I will let y'all know to share it with everybody that you can think of. And we'll have a bio and description of what we are, who we are, and what we do. And we're really excited about that. So that's it for what I got. And so if nobody has anything else, we'll go ahead and adjourn. And time is 4:04, and we'll see you on March 7th at 3 p.m. Thanks, everyone. Appreciate it.
Happy birthday,
Bye.
Valerie.
Thank
Happy-
you.
Happy birthday.